Hi everyone, my name is Chris. I'm a certified wound ostomy continence nurse, or CWOCN. But what is that? Maybe you've heard of this title, maybe you've worked with a CWOCN, or maybe you want to become one. Well, then this video's for you. I have a Master of Science in Nursing degree with a focus in health informatics. I've also been a nurse for over 10 years. I worked in many different settings throughout my career, such as nursing home, med-surg, emergency department, and home care. I feel like I've seen a lot of what nursing is. In one of the hospitals where I worked at, there was a big teaching session. It had surgeons, nurses, and management. It was about a wound vac, or negative pressure wound therapy. Maybe you've heard of that, or maybe you've worked with that. Anyway, the person teaching us was a wound care nurse. She was so knowledgeable and confident about what she was saying. It was the first time in my career that I saw a nurse teach doctors, and it really intrigued me. I wanted that knowledge and confidence because I didn't really have that. I also didn't feel like I was really satisfied at the bedside. I wanted to do something more specialized. Looking back at my past experiences across all those settings, there were always wounds. So remembering that teaching session, I googled how to become a wound care nurse. The first link that showed up was to Rutgers University because they have a wound care program, which is where I attended and where I graduated. And then the rest was history. So how do you become a CWOCN? Well, you have to go back to school first. There are a few accredited schools in the country. There's an updated list on the Wound Ostomy Continence Nurses Society's website, and I'm going to put the link below. Generally, you need 1 year of nursing experience post-bachelor's degree, and you need a minimum of a bachelor's degree. You can also have a master's degree or a doctoral degree, but minimum of a bachelor's degree. There are also advanced practice nurses like nurse practitioners who also go to these schools. Once you're in school, you go through didactic and then you go through a clinical practicum. Depending on the program, it can take up to 10 months. In the didactic portion, you learn wound, ostomy, and continence care in depth. You can expect writing research papers and also taking exams. In the clinical practicum, you follow a CWOCN so you can practice your skills. This is traditionally done in person, but you can also do it online. Some programs do offer an online option for a clinical practicum, or a hybrid of both. Clinical practicum online and in person, but I highly recommend doing it in person for the hands-on skills. The clinical practicum can be anywhere from 120 hours to 160 hours, depending on the program. So now after you pass the program, you're eligible to take the board exams. There are 3 board exams: wound, ostomy, and continence, WOC. You don't have to take all 3 exams, you can take a combination of whichever. However, it is highly recommended to take all 3. There are many certifications for wound care. However, the CWOCN certification is the gold standard for nursing. It's legally defensible because it is accredited by the NCCA, or National Commissions for Certifying Agencies, and the ABNS, or the American Board for Nursing Specialties. And considering you have to go through that entire program in order to take the exams. It is also worth noting that there is another way to become certified as a CWOCN without going to one of the programs. It's called the Experiential Pathway. The details about it are on the Wound Ostomy Continence Nursing Certification Board's website, and I'm going to put that in the link below. So what does a CWOCN do? A CWOCN has autonomy. They can function as a consultant, a clinician, an educator, a quality nurse, and a researcher, to name a few. They're specialist nurses. A CWOCN can work in many settings, for example, nursing home, hospitals, clinics, and in home care. Take me, for example. I work at a large academic medical center. My team and I see so many complex wounds, ostomies, and fistulas. Usually these wounds have trouble healing. If it's an ostomy or a fistula, they may have trouble pouching it. So basically, how do you best manage these wounds, these ostomies, these fistulas that are all complex? Well, that's what a CWOCN helps with. I also do weekly wound rounds in one of the ICUs. So these are examples of the consultant and clinician role that a CWOCN may do. I also teach our specialty portion of the general nursing orientation. We host a skincare nurse workshop quarterly. Monthly, we conduct the pressure injury prevalence surveys. We also host a monthly skincare council. We also teach our physician colleagues, physician assistants, nurse practitioners, physical therapists, occupational therapists, dietitians, etc. Now, these tasks that we do relate to the educator and quality nurse role that the CWOCN may do. Because of these mixture of roles, you may find yourself working split between an office and also on the units. Now, the salary and work hours depend on where you work, but it is competitive because you are a specialist. What I find cool about being a CWOCN is that it's multidisciplinary. The boundaries of skills blend together. For example, as a CWOCN, you may find yourself doing the same wound care and wound treatments as a physician or as a physical therapist. There are so many conferences and conventions that you're going to see all these different professionals. It allows you to network and also to exchange knowledge. No matter your professional background, everyone has something equally important to contribute. So it feels like we're all equals in wound care. And every time I go to these conferences and conventions, I really feel like I'm in a unique career, which is refreshing. I hope that you understand more of what a CWOCN is. If you're interested in becoming one, don't hesitate to reach out to me or a CWOCN that you know. Please like and subscribe. Also, let me know in the comments about some topics you'd want to discuss. Also, stay tuned for my other video about a day in the life of a CWOCN. Till next time, stay vigilant.